What's up, y'all? This is Carolina Doc PT, and today's video we're going to be talking about a topic that you may or may not want to even know about if you are one of these patients, and that is what it's like to remove the staples from your knee following a knee replacement surgery. Okay, so my experience removing staples has been, it's not really that big of a deal. Okay. I think people, especially ones that are squeamish with wound care and things like that, for them, they kind of make a bigger deal of staple removal than it really is. It's, for the most part, it's not even hardly very painful. The patients report that it stings a little bit, but that's it. So let me just go back. So after your knee surgery is completed, what your surgeon will do often to close that surgical incision, they will, suture on the inside. Use sutures that will just, dissolve on the inside of the knee and the skin, and as they continue progressing up, they get to the final layer of skin, and then I can't even say often anymore, because so many surgeons in our area are moving away from doing this. So a lot of surgeons in our area are moving to using surgical adhesives to do that final layer of closure. And my experience with that has been that seems to work just fine. It's patients, I think, tolerate that a lot better, because just the idea of the staples in and of themselves being in your skin, a lot of people don't really like just the idea of that. And people are concerned about, well, what happens, and how does this work as you're removing them? So how your surgeon is going to close, you need to talk to them, and they can tell you what their procedure is. So as I say, it's not uniform, in other words. If you do close with staples, then those are going to be removed on day generally either 14 or 15 post-surgery. A lot of surgeons nowadays have gone, or at least in our area, have gone to wanting those removed in the office. So then that way, if there's any issues with potential infections and things like that, they can make sure that they've got it all accounted for on their end. However, we still have a lot of surgeons that will also be fine with the physical therapist actually removing those staples. More often than not, that actually will not fall to the physical therapist. It generally will fall to the home health physical therapy assistant. The PTAs do the vast majority of removal. At least that was my experience in home health. PTs, we still do them, but it's just typically, because the visit is either day 14 or 15 post-surgery, that typically falls on a visit that the PTA was doing. That all said, I've done my share of surgical staple removals, and as I said at the outset, not that big of a deal. So the process of removing the staples, there is actually a toolkit that we are issued that is specific for this purpose. It has the staple removal tool in it. It also has steri strips, generally has some alcohol wipes, and may additionally have a little packet of glue in there. And so what we will do is we'll take the staple removal tool out, and that is a device that has two little prongs on it, or has three little prongs, excuse me. Two over the top, one on the bottom, and how you use it is you go into the center of the staple, you slide the prong, I generally slide the two prongs underneath it, or underneath that staple, and then you quickly will clamp it down and flick your wrist, and that will make the staple. You're putting it into the center of the staple, so then the staple will bend and pop right out, and then you just lift it out of the skin, and it's a very quick process. You will typically go up. At least how I like to do it is I'll start at the bottom, and you'll go every other staple all the way up the incision, and then you'll come back down, removing the remainder of the staples. You want to go every other one, just in case there was some issue where you find out that incision is not fully closed. That's really rare. That's called dehiscence. I actually have a video on that I will actually link to this video that kind of talks about that. Usually you'll run into those types of issues with the dehiscing of that wound, or that surgical incision. Dehiscing means that it's just opening up in a way that it's not supposed to, because it's supposed to be closed at that point. Usually you only run into that sort of an issue if there's an infection present, and you usually would learn that there's an infection present several days or hopefully weeks before you get to this point. But I have had it happen, not to me, but a PTA that I worked with. I know we had a patient at one point where she had that as an issue. She started removing the staples, and it actually started dehiscing. It started coming apart on one side, and that's not supposed to do that. If that was to happen, what you do is stop immediately and call the surgeon, and then that person is on a trip either to see the surgeon, or they're on the trip to the ER to have them take care of the rest of the staple removal and surgical incision care, because there's an apparent infection present that no one was aware of. So that's how you handle that if you were to run into that sort of a situation. But typically, that's not the case. As I say, typically you will remove the staples, you go straight up and straight down. Patients usually feel a little bit of a sting as you're removing the staple, but the trick is to do it quickly, and it's you clamp down on the staple removal tool and flick your wrist at the same time, and it pops it right out. And sometimes patients don't even feel it, so it kind of just depends on the patient on that one. But then once you have removed those staples, then we'll go back over it. We generally will clean it, and then put steri strips down. And the steri strips are just a little tape. Use little strips of tape that you'll put down all the way down the incision. Some surgeons as I said, there's glue that they will sometimes like us to run on either side of the incision. That is usually in the surgeon protocol that we are following to remove the staples. And after that, that's it. That's all it takes. It's very simple. The steri strips then will remain in place until they fall off. You do not peel them off yourself. They will come off in the shower. They'll come off just over time as your body continues to heal. Then that skin, because you're healing from the bottom up, and as it's healing up, it will just, eventually the steri strips will all come off, and then you're left with your surgical incision scar, and that's it. Very simple procedure, very simple process. It's not as bad as what people think it is and maybe make it out to be in their mind. I'll tell you, it's even I've had patients even ask if they could remove them themselves, and I know you're not allowed to do that. No need to be too afraid about it. It's a very simple procedure to remove them. It generally takes, the entire thing generally takes about 5 minutes, and usually whenever I have done them or done them in the past, I like to just do it straight away and then proceed with physical therapy right after that. Usually the patients do like it after having had them removed, because their skin now is a little bit more pliable at that point, and they do feel like, I can move it just a little bit better. So that's usually the feedback that you get with patients. Anyway, I hope that this gives you a little bit of information, just where it, kind of takes out some of the uncertainty so that you don't have a fear or a worry over what it's going to be like to have those staples removed. It's really not that big of a deal. So I hope that this has been of some benefit to you. If it was, please like the video. Please share it out to any family or friends that you think could use some of this information themselves. And if you haven't already subscribed, please subscribe to this channel, and we'll put down also any comments in the video. If you have any questions or anything that any topics about your knee replacement or anything else. I'm a physical therapist. We do a lot of stuff other than just knees. So if you have any questions or anything, please let me know. I'd be happy to try to help the best that I can. All right, y'all have a good one. Later.